Bismillahirrahmanirrahim. Assalamu alaikum everyone. Myself Anas Jahangir. I'm lecturer at Foundation University College of Allied Sciences, Foundation University Islamabad. I'm here to present my abstract. So, just a second. So first of all, what do we have in our abstract? And the title of our study is Comparative Analysis of Public and Private Hospitals regarding hand scrub, or you may say it, surgical hand scrubbing protocols. So first of all, what does hand scrub means? Hand scrub refers to a scrubbing method that WHO has told us with 7 steps, और these जो steps हैं these are important for ऑपरेशन थिएटर में वर्क करने के लिए in order to be a part of surgical team or initiate or assist a surgery. So back to our study. Proper hand surgical scrub protocol is critical for preventing surgical site infection in healthcare settings. Regular monitoring, evaluating, knowledge, compliance. Compliance is most necessary thing in this scenario, and providing feedback is essential to uphold the patient's safety standards. The study assessed adherence to the WHO surgical hand scrubbing protocols across public and private hospitals in the city of Multan, Pakistan. Okay, so the problem. Where is the problem? HAIs, hospital-acquired infections, pose a significant threat affecting nearly 1/3 of surgical patients. So आप लोग imagine कर सकते हैं 1/3 of surgical patients में अगर HAI, hospital-acquired infection आ रहा है, तो this is a very significant ratio. But do these infections due to the patient, these infections lead to prolonged hospital stay, increased treatment costs, and poor patient outcomes. Okay. Crucially, studies showed that proper hand scrubbing alone can prevent a substantial 30 to 50 of HAIs, underscoring its vital role in patient safety. And this 30 to 50% ratio is like much more. इतना surgical site infection या hospital acquired infection we can't bear. Okay, what were the research objectives? And the research objective of our study were assessing operating room staff's knowledge according to WHO hand scrubbing guidelines of surgical scrub. And second objective was to measure OR mean operating room staff's compliance to standardized hand scrubbing protocol. And the same were the research question. What is the level of awareness among OR personnel regarding WHO protocols? And do surgeon, nurses, and OR technicians, operating room technician follow protocols at the same rate? Okay, coming to the methodology. First of all, study design. We used a descriptive cross-sectional study for the duration of 3 months, which ranged from June to August 2025. The location of our study site of our research was Multan, Pakistan. And there were 150 operating room staff involved as a participant in our study. This 150 figure contained surgeons, nurses, technologists, technician, and anesthesia technologists. There were 3 public and 3 private hospitals involved in our study. Data collection was done by using online questionnaire survey. And data analysis was used by using IBM SPSS statistics version 25 and chi-square in this test. Okay, the finding of our study, public versus private sector hospitals. Our study revealed distinct strengths and shared the adherence level between private and public sector hospital concerning hand scrubbing protocol. So talking to private hospitals, the mean score which was adhered with mechanical compliance was 1.91, while on another hand in public sector, sorry for the mistake of spelling, and that was 1.36, means in the public sector this was pretty low. In private sector hospitals, knowledge-based practices were 1.91 and knowledge practices were 1.49. Okay. Then shared compliance, cohort clinic compliance was 1.64. These were of results of private hospitals. In public hospitals, knowledge was 1.61, while knowledge in private was 1.65. Shared estimated compliance was 1.64. Okay, you can see there is a huge difference. The mean score of private hospitals was more than public. डेमोग्राफिक वेरिएबल्स पे बात करते हुए according to hospital type, we divided 150 participants, 50% from public and 50% from private. While coming to gender, male were 53.3, while female were 46.7. According to age, we had 25 to 30-year-old patient, and that were 73.3, and 30 to 35 year were 24.7, and 35 to 40 years old were 2%. Professional roles, there were 20% surgeons, 20% scrub nurse, 20% surgical technologists, 20% surgical technicians, and 20% anesthesia technologists. We also put experience in our inclusion criteria. The persons with 5 years of experience were 69.3, 10-year experience were 22.7, and 15-year experience were 4%. And more than 15% population, more than 15 years experience population were 4%. Okay, talking to the mechanical compliance score, and here we can see. And this bar stands for private hospital, and this lesser bars stand for public hospitals. Okay, hands elevated on over entry. बेसिकली इसका थोड़ा सा बैकग्राउंड जानना जरूरी है. व्हेन यू गो, आपको अपने हैंड्स कुछ इस तरह से रखने होते हैं ऑपरेशन थिएटर में एंट्री करते हुए. जब आप उसको इस तरह से रख के जाते हैं, नीचे हैंग नहीं करके जाते, तो दैट इज बेसिकली के वो जो आपका ऊपर से फ्लोरा नीचे को आना है, कोई माइक्रो आना है, वो नीचे को लाइक ड्रॉपलेट्स के साथ, ड्रॉपलेट्स तो जा पाए, बट अगर आप उसको नीचे यूं रखेंगे तो यहाँ से अनहाइजीन एरिया से कोई जर्म आपके इस एरिया पे ट्रैवल कर सकता है, तो हमेशा आपसे डाउन होता है. तो प्राइवेट सेक्टर में दिस वाज प्रेटी हायर देन पब्लिक सेक्टर. Rinsing without back and forth. Back and forth is basically a protocol given by WHO, which involved rinsing without back and forth. बैक एंड फोर्थ नहीं करना, बिकॉज अवे फ्रॉम सेंटर जाना है, उस जगह पे घूमते नहीं रहना कि वो माइक्रोब वहीं रह जाए, या अनस्टेरलाइज्ड अनहाइजीन एरिया से वो इधर को आए. Using sterile nail cleaner. Talking to sterile nail cleaner, this means ke sterile nail cleaner we use in, those are like brushes we use in our nails while scrubbing, that were also high in private sector than public sector, and elevated during rinsing, that were almost equal, and even like private sector was having lesser score than public. Using back to open OR doors, private sector hospitals staff was using their back to open OR door, and public sector OR staff was using their front side for opening the operating room door. So basically, door का क्या link है? When you open the door from your back side, you have to keep your back area contaminated, but you can't have your front side contaminated. Okay, moving next. Question of discussion. Interpreting the findings. Okay, what were the findings? Private hospitals mechanical advantage वहाँ पे था because they had better resource availability, sterile nail cleaner at all stations. They had strict supervision and training protocols as per PHC guidelines. Lower patient volume was in private hospital, तो उनको एक टाइम मिल जाता है प्रोसीजर के, लाइक हैंड हाइजीन का प्रोसीजर प्रॉपरली फॉलो करने का. Moreover, private sector had better infrastructure and equipment. वहाँ पे लाइक उनके पास सेंसर्ड स्क्रब एरियाज थे जो कि कहीं कहीं पब्लिक सेक्टर में लैग कर रहे थे। पब्लिक सेक्टर के जो हॉस्पिटल थे उनका नॉलेज स्ट्रेंथ क्या था? स्ट्रॉन्ग फाउंडेशनल ट्रेनिंग ऑन डब्ल्यूएचओ प्रोटोकॉल, बेटर अंडरस्टैंडिंग दे हैड ऑफ पोस्ट स्क्रब स्टेरिलिटी प्रिंसिपल, अवेयरनेस ऑफ करेक्टिव एक्शंस, री-स्क्रबिंग का रोल पब्लिक सेक्टर में दैट वाज हाई। Knowledge is present, but execution is constrained. Execution is constrained due to, first of all, resource limitations. Second point is like there was a huge patient burden. Then the critical gap was not a knowledge problem, but a systemic one. Why systemic one? कि वहाँ का सिस्टम और वहाँ के सिस्टम में पेशेंट लोड ज़्यादा था, रिसोर्सेज लिमिटेड थे, टाइम नहीं मिल पा रहा था, सुपरविजन स्लो थी, ट्रेनिंग बार बार नहीं हो रही थी उस चीज़ की। दे हैड नॉलेज बट ट्रेनिंग भी तो इज एन इम्पॉर्टेंट फैक्टर। In pressure and high caseload compromise compliance, resource limitation directly impact practice, staff awareness doesn't translate to consistent action. Okay. Why the gap exists? Gap क्यों exist कर रहा है? That is systemic barrier. The compliance gap is not due to knowledge deficit in public sector hospital, but rather systemic pressure. System का pressure था, time constraintness का, high patient volume का, resource shortages का. Otherwise knowledge was equal. Even few time public sector में आपके बहुत competent लोग work कर रहे होते हैं, dean director level के लोग. Okay, what were the conclusion? Private sector showed better mechanical compliance, while public sector hospital show better knowledge-based compliance. Okay, उनकी mechanical थी private की और public की knowledge-based compliance थी. What were the root causes? The compliance gap stems from the systemic pressure rather than knowledge deficit. Knowledge deficit किसी side पे नहीं था. Significance: addressing systemic barrier is essential to improving patient safety. ऑब्वियसली पेशेंट को जब हेल्थ केयर एसोसिएटेड इन्फेक्शन होने का चांस नहीं होगा, रिस्क नहीं होगा, तो उनकी सेफ्टी कंप्रोमाइज नहीं होगी। व्हाट आर द रिकमेंडेशंस ऑफ आवर स्टडी? प्रोटोकॉल एडहेरेंस, क्वालिटी इंप्रूवमेंट, these two are the important steps. First of all, staff should follow official WHO guideline for timing and method. Like timing को लेके first scrub of the day should last for 8 to 10 minutes. Keep the hands elevated above elbows after scrubbing. अपने hand अपने यूं रखने हैं, उनको नीचे नहीं लेके जाना. Rinse carefully from fingertips down to elbows. आपने rinsing भी fingertips से elbows की तरफ करनी है, not आप यहाँ से ऊपर को आ रहे हो वापस. Avoid टचिंग नॉन स्टीराइल सर्फेसेस. अगर सेंसर नहीं लगा हुआ तो आप जहां से स्क्रब ले रहे हैं उस टैप की जो टैप है, जो उसका हैंडल है, उसको क्लोज करने के लिए यूज होगा, वो भी नॉन स्टीराइल है. कुछ लोग वहां पे एक मिस्टेक करते हैं, वहां से स्टेरिलिटी बढ़ी जाता है. क्वालिटी इंप्रूवमेंट मेजर जो है, इम्प्लीमेंट रेगुलर मॉनिटरिंग एंड ऑडिटिंग, यूज वीडियो डिमॉन्स्ट्रेशन फॉर ट्रेनिंग, उनको 7 steps ऑफ हैंड स्क्रब प्रोटोकॉल पढ़ाए जाए, डिस्प्ले WHO हैंड हाइजीन पोस्टर इन ऑपरेटिंग रूम, provide ongoing staff education and feedback. This is most important. Okay, आगे उसके हमारे references हैं. Thank you for your time and attention. Proper surgical hand scrubbing is critical for preventing the infection. By addressing systemic barrier and maintaining rigorous compliance, we can significantly improve patient safety across all healthcare settings. Thank you for your attention. Once again, I am here for any type of query. You can email me at anas.jahangir, anas.jahangir @fui.edu.bk. Thank you.